I'm hoping you like can't hear my AC because it's kind of loud, but it is 96 degrees outside, so it's staying on. So currently I'm obviously at the college where I go to school. I'm here early because financial aid is kind of screwing me in the butt right now, but that's a whole nother story that maybe I'll talk about after all of it is done and I have my loans and whatnot, because right now it's a no. So it is now week three. Basically, first week I am taking a night class this time around, so I'm not taking a day class. So I've been basically going to class from 6:30 to 9:30, and then busting my booty down the road about, I think it's like 6-7 minutes to my work, which is quite nice that it's like super close and everything like that. So, but I only work 2 days a week now, possibly more at this point. I don't know. I know the other girl and I that take the night class together, that also work nights together, we've been picking up some weekend shifts for some people. So, because like right now it hasn't been like too crazy. We did have our first test yesterday, so we'll have tests every Monday from now till the end of the summer semester. Wasn't too sure about it because guess what? Fluid and electrolytes, statistically, all around is always going to be the hardest test in nursing. It is always the lowest scores. It has always been that way, even on NCLEX, doesn't matter, because it is a lot of data that is up, down, left, right, and even like seasoned nurses sometimes still have issues with fluids and electrolytes. And that's why a lot of like when they do labs, like ABG labs, that's why there's like respiratory there, which they're like specialized in it. The doctor looks at the labs, you look at the labs, the computer analyzes the labs. So I can't say we can rely on the computer 24/7, but at the same time, like, it's just a lot of numbers. So statistically, that test is always the lowest. I did pass, so I made a 76, which is barely passing because 75 is passing my program. So I feel happy because I didn't feel very happy walking out of that test because, like, I think it was 80 questions and I think 50 of them were like, here's your O2, here's your pH, here's your CO2, and here's your CO4, and what do you got? And I was like, are they vomiting? Did they overdose? Like DKA? Like, somebody throw me a bone. But then some of the questions were like easy like that, like they're nausea and vomiting, so like you obviously know what's going on. So, or like they're in DKA or they overdosed on morphine. So those were easy to choose. Our teacher did go over the test yesterday, which I really like because one of our night teachers we've had, I had in my LVN program a few times, absolutely love her. So it was nice to know one of the teachers going back in, but right now she's been in Guatemala because my school does a mission trip in the summer. I'm eligible to go if I want to next summer, like it'll be like after I graduate, so I'll go as a graduate. I had the option in LVN school also, but we just moved out, we were getting married, so I don't know, it just depends on lots of things right now if I do want to go on that or not. Right now, I think it would be awesome to go do, but they go with a church, and I'm not religious, kind of, sort of. They do a lot of like outreach, like a lot of stuff with a church, and I just don't know if I would be 100% comfortable with that. I would just want to go down and do the nursing stuff, which, you know, I could always just be like, just stand there while they pray. But it's also quite a bit of money to go, so I'm just not 100% sure. And I don't have to like choose till like February. So it just depends. So that's been going on. Then what else? We've done a little bit of math. We haven't really done our math test yet, only because the teacher that we normally have has been out. So we've been having a new teacher who a lot of the teachers here also have like this is like their side job, even if they're like full-time teachers here. So like a lot of the other ones, like I've seen like out in the practice or seen like while we were in clinicals. But this one, she was from the Army and stuff like that. So like that is like super cool, because that's always been something on my mind, was to go the Army route, only because, you know, they'll take care of your family forever, yada yada. But also, you know I can't go and serve my country. Like, I know I can't go shoot the guns, do that sort of stuff. But if I could be home and taking care of the soldiers or soldiers' families, stuff like that, I think that would be absolutely wonderful. That would definitely be my spot. I still want to do labor and delivery. But right now I'm just kind of like, wherever the wind takes me, like, I'm gonna go. That's basically how I did LVN school, and I ended up in geriatrics. Still love it. But as an RN, you get into management roles with that. So a lot of places don't keep RNs on the floor because it's a lot more expensive than keeping LVNs, because you're paying LVNs, med aids, CNAs. So, which I totally understand. This is so sideways. I'm trying to think of anything else that's going on with school. We haven't taken our math test yet. We went over some pediatric math and just some regular doses calculations, some IV drips. We are doing Saturdays, and our Saturdays so far have been, to me, shitty. Because we're basically going over skills, which I totally understand going over skills, but it's been so discombobulated. Like, we had our first Saturday, we got checked off on hand washing, blood pressure, and PPE, which I understand. Those are 3 main things that are like big things. So I'm like, I totally understand. Then we started like head to toe assessment, and basically at the end of this semester we're supposed to be able to do a 20 to 30 minute head to toe assessment, and it's going to be recorded. So I'm like, I do head to toe assessments every day at work, and I mean, I can give a full detailed one 20-30 minutes, yes, but when we spent 4 hours on the head, eyes, ears, neck, I'm like, you know, I don't know how much more I can do on that, you know. Ooh, my husband's right here. What you doing, boo? And then last weekend, basically our teacher didn't even show up, so we had to text one of the other teachers and be like, hey, nobody's here, WTF. So that was great. So I'm hoping this weekend will be different because I have to work. So bump it up for you.
It's looking hot.
Want to say hello?
Not particularly.
But yeah, it's week 1, 2, and 3 so far. Yeah, that's all I got.